talking about inclusion. Not everybody gets a chance to have inclusion. And sometimes, even though we do live in a community, people with disabilities does live in a community, but we don't always have a chance to be included in stuff. And you know what? And sometimes we have to invite other people to make sure they feel included too, that don't have disabilities. So it works both ways. So we're talking about all inclusive of everyone. So we have speakers here who are going to explain to you and give their stories about what does it mean of all inclusive. What does it mean? And how do we partner up? And how do we want to move forward of sitting at the table? That's what we're talking about. So I'm going to call Pastor Giles, and he's going to give the blessing and talk about, hopefully he will be talking about inclusion in his sermon and his blessing as well. But I don't control Pastor, so you know.
Good morning. I will not be giving a sermon today.
That was a joke.
Yes.
That was a joke.
However, I will be opening up in prayer. Now, for those that may not know, I'm the president of Voice of Buffalo, and we are very strong supporters of the Accessibility Task Force for the movement that's going on in our push toward equity and making sure that we create space and an environment in this society that they can be at the table and they have equal access. That is an important issue for us, and I am so glad to be here. Thank you, Marie and Mike, for inviting me. Let us pray. God Almighty, you who are the creator of all things, God, we ask, God, for your help and your blessings to be upon this effort. We pray for all of those individuals that have locked arms with us to say change is needed in this area, Lord, and we want complete access, Lord, for the least of our community and all of those, God, that we may be a fair and just society. I pray your blessings on this building, Lord, and the work that's going to be done here, Lord, and this office that's going to be the site for the Accessibility Task Force, God. And I pray now that all of these blessings will come in whatever name that you are referred to, God, by whatever religion, whatever holds, God. We know you as the one God, and we thank you now for what you're doing. Amen.
My name is Advocacy, and I am a self-advocate, and I am also a member of the accessibility that first. Don't bring them with the big move from with Senegal. It's important so that people with disabilities can have to be at the table making decisions about the services now in a future. Have the freedom to 20 staff fully and have built some more fulfilling lives. And also, we ask people with disabilities want access to the office so that people like myself want to walk out at the office. It is so very important that we remain about the workforce as members of society. Thank you.
Hi, I'm Sheila Bruce. Thanks for everybody that came out today. The task force would like to thank the Office for People with Disability for working with us and creating the satellite building, the office here at 1021 Broadway, and accessible by public transportation. I feel like it's important for us to all be included, for it to be accessible for everybody. And it's nice because it's on the bus route for somebody like me that take the bus. And I just appreciate all the hard work that we've been working on getting into this building. Thanks for everybody's support.
What a wonderful group and what a wonderful event. I am just so pleased to be here and to speak on behalf of the Office for People with Developmental Disabilities. We are just so happy to be here and announce and work with you on plans to have a satellite office for the regional office here at 1021 Broadway, along with our Sandy's group. So, can you not hear me? Is that better? Thank you, Essence. I appreciate you bringing it to my attention. So again, we heard the concerns of individuals and families and advocates. So we are working to develop both short-term and long-term solutions to make our services and the employees that work for OPWDD more accessible to the families and individuals who need them. You know, in the coming weeks, we're going to be seeing some work starting here, and this is just really exciting. And while OPWDD is not going to have a lot of space here, we are going to have conference room space and office space, and our goal is to rotate staff that have key roles in the regional office so that at different times, the folks that need to meet with those people and talk to them about their services will make themselves available. And we, in the regional office, we continue to do that and provide those services throughout the 7 counties of Western New York that are represented by the staff at the DDRO. Just this year, we have probably held over 100 different meetings throughout the 7 counties of Western New York for front door information sessions, self-direction, fiscal intermediary, family support services. We are committed to make sure that we bring those services out to the community. So certainly, while we don't have full accessibility in our offices, the expectation is that our staff are accessible to all counties in our catchment area. And we make sure these are held on evenings and weekends as well, being mindful of work schedules of families and individuals. The expectation shouldn't be that people should have taken time away from their work day to meet with folks from the regional office, so we make ourselves available for those hours as well. So we anticipate, the next step I wanted to talk about was the shuttle service. So I know that we did stop the shuttle service that was currently running to the regional office, and we did that because of underutilization. we need to be good stewards of our taxpayer dollars, and we do have to review contracts when they're being underutilized. So what we are now going forward with is a shuttle to Western New York campus in West Seneca that will be available to folks in Erie and Niagara County for when they need to be there for meetings, appointments, assessments. So we're hoping to have this up and running by the end of the year, so it will increase accessibility for folks that don't have the ability to get to the campus. So this should improve the service, so we are looking forward to have that up and running and improve from what was in the last contract that just was not being utilized, because not everybody even lives on a bus run to get to the Southgate campus. So this will actually take them door to door. We will be picking people up at their homes and bringing them to the campus for those needed meetings, and then providing that transportation back home. So these two major steps forward for accessibility will enhance OPWD's current practice of utilizing available sites throughout the 7 counties of Western New York to provide the trainings, assessments, and evaluations for families. We look forward to continuing to work with all of our stakeholders to ensure these services and supports are more accessible to those who need them. So again, I just celebrate today. This has been a long time coming. We have been working on this for a long time. I am just so proud to be here and be a part of this, and I look forward to seeing it really come to life. So thank you very much.
Good morning. Good morning. Oh, you guys don't sound as excited as I am, so good morning. Good morning. Welcome to 1021 Broadway, where access is a right. Right? Yeah. Right. That's right. So Jericho Road Community Health Center is excited to be a part of this partnership, is excited to be a part of 1021 Broadway. This is the current home of Jericho Road's primary care services. We also have Western New York Imaging, which is available in this building as well. The Independent Health Medically Oriented Gym is also available in this building, as well as a retail pharmacy. We are also planning on having a dental clinic because, again, access is a right. We want to make sure that this community feels welcome, as well as anybody else who's going to be seeking services out of this location. We are also extremely excited because this is the future home of the Western New York Human Services Collaborative, which also encompasses the relocation of the OPWD office having a satellite location here. So at Jericho Road, our vision is for the underserved and marginalized individuals, families, and communities in Buffalo and around the world to have access and to become healthy and whole. We believe that wholeheartedly, which is why we are here. We're excited to have all of our partners come with us to truly make sure that all these services are available to anyone and everyone who's going to be working out of here. As we celebrate this first day of Disability Employment and Awareness Month, Jericho Road, our CEO and founder, Dr. Myron Blick, and on behalf of our board of directors, we stand with our partners and look forward to the relocation of the OPWDD office, satellite office being here at 1021 Broadway. Thank you.
So as you all know, we're living in a time of cutbacks and system redesign in an effort to continue to be cost effective. Given this effort, it is important to work together to find innovative ways to meet the needs of the community and to consolidate resources. This is one of the aims of the Western New York Human Service Collaborative, which is operating under the Care Management Coalition. We are happy and honestly thrilled to welcome OPWDD into the mix, and we are glad that we can be one small part of the solution to this long-standing problem of inaccessibility to people with developmental disabilities and to families in this community who deserve access to services, advocacy, information, and of course, jobs. The overriding objective of 1021 Broadway for Jericho Road, for our collaborative, and for all of the other partners is a simple one: serve more people more effectively by providing more comprehensive and integrative package of services and programs that will address more of their needs. For our employees, 1021 Broadway provides a place where true collaboration happens, not just sharing space, but services and staff and programming and funding. Again, with the goal to do more good for more people. And for our funders, we are creating a model of collaboration that drives a higher share of their dollars into direct programs and services and not to overhead. Our agencies serve children, parents, individuals, and families. We serve those with mental health and substance use challenges, immigrants and refugees, those with developmental and physical disabilities, families living in poverty, families living paycheck to paycheck, and families who have a little more economic stability. We serve the young, and we serve the not so young, and many more, with programs and services that make a real difference in people's lives. The work that each of our agencies does separately is impressive, and that's why I'm so proud to be a part of this collaborative and the effort to serve all of our families in a more comprehensive and cost-effective way. Just think of all of the good we're going to do together. We are hopeful that you will join us again in 2020 as we announce the grand opening of this collaborative space. And it'll be beautiful here by this time next year on the 4th and the 5th floors. And if you're interested in contributing to our capital campaign, see me after this.
Mike Rogers, I'm from the Self-Advocacy Association of New York State. And if we look back at the history of people with disabilities, particularly self-advocacy and advocating, we see our founder, like Bernard Carabello, pushing for deinstitutionalization back in the early and middle 80s. We made that happen by collaborating with the OPWDD, by working in their offices as employees, by having offices near their offices so we can talk to them and collaborate with other people and supporters as well. So we did that. We made that happen. People are now living in the community, whether it be in group homes or interdependent. They are doing that. We brought to a former commissioner the idea of self-direction and self-determination, and we've been pushing person-centeredness and planning for people's lives. We've been pushing for people to live more productive and inclusive lives. And we've done a great job. We've worked very well together, but that's because of proximity in many ways. We're there, we're at the table, we're in the offices, we're around, we're in meetings. That's proximity. So I've been asked to give my vision of the future. My vision of the future is really full access in society, where we do not have barriers, where we where we can get jobs, where we can have homes, where we can have lives, where we can get married, have babies. Did I just say have babies? Yes, I did. But you know, and we're thankful that we have the satellite office coming here. But my vision is not going to happen fully for a reason if we don't work together. Right now, out in West Seneca, at the former developmental center, there will be only one advocate working in that office soon because people cannot get out there. So we need a full office with full access, no impediments, for full inclusion. Straight up, and that's my thing that I'm gonna say.
For you that don't know me, I am Samuel Matto. I am the Executive Director of the Center for Self-Advocacy. And I thought about what I wanted to say today. Some of it's good, some of it's not so good. So I will start with the good. About a year ago, next Thursday, I would have left OPWDD. Was my last day, and I went to be a full-time executive director for the Center for Self-Advocacy. There's many reasons for that. But one of the reasons was about access. Access in OPWDD the DDSO, and that was a question in my mind. Even if I used self-direction, the person that drove me every day was looking for a new job. She got one in Batavia, so I wanted to have the opportunity to have access in that way. And then I found out that they were cutting the shuttle, so I want to have access that way. And one of my closest friends is now going to move from the main office to an office that's accessible for him to get to because he can't get to the main office. Now, I'm not sure on the statistics, but I'm very close. About 20% of people with disabilities, all disabilities have jobs. 80% don't. And if you break that down to what percentage do people with developmental disabilities have jobs, it's a very low percentage. And then you think about how many people with developmental disabilities have professional jobs. Not that many. Like Mike said, there's only going to be one person at the DDSO regional office. A few years ago, there were 4. So we had one in the regional office. We had one for state operations. I was central office, and there was somebody for IT. 3 of the 4 are not going to be at the main office anymore. Either we moved on to something else, or we're forced to move on to something else, or we asked for a different location. You know, and that comes in the question about access. For people that want to be an advocate, to be able to speak as a professional. And OPWDD at the time gave us the opportunity. The opportunity is not there anymore. You have one person at the main office that can speak for multiple people with developmental disabilities. And that's an issue. You know, so when we talk about jobs for people with disabilities, when we talk about people with developmental disabilities that have jobs, we sit there, I sit there and go, well, let me count the people in the organization that I run. I have 4 people, including myself, with developmental disabilities. And I have 3 people with disabilities and 1 without. You know, that's a pretty good number. You know, for a small organization, as we are Andrew Markham, he's my program coordinator. So I have made sure that the Center for Self-Advocacy had a voice at the table. And I said, Andrew, you have to be at the Voice Buffalo task force at the time, and now they changed it to it. So I just wanted to say that, you know, when you go from 4 people down to 1, and they're not bringing back my job. They're not bringing back the person that had to leave to give him access to the building unless he needs to be there for a meeting. He won't have access to just people in church. He would have to schedule an appointment. And even if we got the shuttle to OPWD main office, he can't use that. You know, and I want you to understand, you know, it's for people with developmental disabilities. But it's not for people with developmental disabilities that were there. So the access is very limited. And that is the issue when you talk about people with developmental disabilities that want to be professional advocates. It's tough. I know I went over my time, I'm sorry. But I just wanted to say, you know, we have to think about the future. Yes, it's a good thing that we have a satellite office. But it's the first step. Like I said in my interview last week, it's just the first step. We have a long way to go. A very long way. And if we don't stop, if we stop and say, hey, we got a satellite office, it doesn't mean anything. We have to keep fighting, we have to keep speaking, and we have to keep on being professional advocates to say we demand that we have full access to a full regional DDSO, state office, central office, and everything that everybody else has who can drive a car. Thank you.
Thank you so much for coming today. And I'm here, my name is Max Donatelli, for those who don't know me. And I'm here to represent the Donny Family Committee. Donny Family Committee, I'm here as a parent. I'm one of 2 parents that's on the task force. And I have a son, now 31, Craig, who has developmental disabilities. He's part of the Self-Advocacy group. Craig has benefited a lot from working with people like Mike Rogers and Marie Malinowski and Sam Meadow and BJ Stasio, who's not here today, but is my current hero right now. So I want to say, hopefully people get a chance to see the article this weekend in Sunday's paper about this issue that we're talking about today. If you haven't, I brought a clipboard with, you can sign your name and we'll get you the link, we'll send you the link because it's an outstanding article. It was written by Sean Kirst and it features BJ. It also features Stephanie Speaker, Sophia Roberts, who's here today as well. And it's important that people understand what this issue is. I started with the task force about 3 years ago. And it had already been in place for probably about 3 years before I got on. And it's a significant issue. Access is the biggest issue, and as was mentioned by both Mike and Sam and Essence and Sheila, access is only part of it. Getting access to the services is a piece of what we're trying to do, but it's also for inclusion. Inclusion is really what we're striving for. It's community inclusion. It's for people working, like Sam just talked about. It's being able to have a job that's a well-paying job, a job that's in the community, have access also to recreation, have access to the kinds of things that the rest of us should be able to enjoy. And by having this center here now, I don't know if people know, this center, this floor right here is going to be mental health advocates, and we do have Ken Hausnick, who's here, who's the head of mental health advocates, and this is going to be their space along with the Children's Mental Health Coalition. Downstairs is going to be the rest of the shared space organizations, and it's double this size. So it's going to be a very large space, but it's going to be an opportunity to be able to build trust. It's going to be an opportunity for these organizations that are serving the people in this neighborhood and the rest of our community. It's going to be an opportunity to be able to work, like Tara Burgess mentioned earlier. It's going to be an opportunity for these services to work together. Other organizations like LDA, as Parent Network, and I'm happy to see Sue Barlow out there. Sue Barlow, and I used to work at Parent Network. We have a history together. It's a good organization, and but I think the reason that I wanted to say something, it's about the collaboration. One of the things that we really, I feel as being a parent, and I feel very proud to be a part of this task force, is because we're working together. We're building trust. We're able to work together. We're building trust also with Ellen Hardy, who's from the DDRO, the regional office. We also have folks from the DDSO here as well. There's two separate pieces. One is state operated, one is the regional office. Regional office does service the 7 counties, as you mentioned. But this is a step in the right direction. It's a step where they're actually offered to have a satellite office to be able to provide services, information, and training, and those kind of things. And also they are going to restart the shuttle, which is an important thing for families to be able to access information to the front door and other, as the system is changing, and it's constantly changing. And then thirdly, they've also offered to have a work group that's going to be focused on inclusion, and that's one of the things that we really want to continue to see is that work group on inclusion, because it's important that we continue to build the trust. And that's something that we want to do. We want to be able to collaborate. We want to be able to work together. So I appreciate everybody coming out today, and also our electeds that are here. I really appreciate it. You're being able to come out today as well, because you've been part of our collaboration as well. And we look forward to being able to be working with folks and really helping to make a difference for people with developmental disabilities. And thank you, Marie, and thank you, Mike, for your leadership.
So thank you so much for being here this morning. I know that I've been working on this with this task force for a long time. As Max has said, and as everybody else has said, it's really a terrific group of people. I'm Frank Kimmerada. I'm the director of the Office for People with Disabilities for Erie County. And I think one of the most important things you need to know is Erie County is one of only 6 counties has an office for people with disabilities all across New York State. We're actually the only county west of New York City that has an office for people with disabilities. A direct advocate, a direct voice for all of you to speak with your county and local government, which is quite important. Another part of my job, and really probably one of the most important pieces of my job, is I'm the ADA coordinator for Erie County. So I'm the one that makes sure that if folks have issues with county services, or if folks have issues or needs with local services, there's somebody that they can call out to. One of the reasons why Marie and Andrew and everybody else has worked so hard is because they deserve that voice. They deserve that pick up that phone and you know who to call. You have that person to call right away. And that's the beauty of this building. And that's the nice thing. But Max touched on it, Sam touched on it. This is a step. It's a step in the right direction. It's not everything. It's not everything that we're looking for, but it is that step, that initial step that needs to be taken to make sure that folks with disabilities don't have to go out to West Seneca. Folks with disabilities can access their services in an accessible location, and that's what we want here. I want to also touch upon that today, October 1st, is the first day of Disability Awareness Month. It is also the first day of National Disability Employment Awareness Month. I think Maggie, you touched on that, right? That started, I don't know if you know this, in 1945 when President Truman actually signed Public Law 145, designating it as National Hire the Handicap Week. Okay, we no longer use the term handicap. We focus on the term folks with disabilities, right? That person-first language. But so we have a lot going on in October, and all of that it's all about all of you. It's all about making sure that collaboration and that inclusion is happening. So let's keep moving forward. And let's you all keep doing the work that you're doing, because you're doing terrific work.
My name is J.R. Drexelius, and I represent Donnie, the Development Disability Alliance of Western New York. Donnie is a collaborative group of over 40 member agencies providing supports and services to over 33,000 individuals with intellectual and developmental disabilities and their families and their circles of support. Donnie agencies employ over 22,000 individuals in the 17 counties of Western New York and the Finger Lakes. Donnie is pleased to join the Voice Buffalo Accessibility Task Force in calling for the creation of an inclusive task force and seeking common sense solutions to allow individuals with disabilities to live productive and fulfilling lives in the community. The state has indicated it seeks to help people lead richer lives in the community. The provider community Donnie represents continues to seek to collaborate with the state, individuals with disabilities, and their families to create a person-centered service environment that is innovative and focused on community resources and self-direction principles. Our shared goals are to facilitate outcomes allowing individuals with disabilities to live in the home of their choice, to work and engage in meaningful activities to contribute to their community, to have meaningful relationships, and to have good health. Our current infrastructure does not adequately support the right of individuals with disabilities to live and receive services in the most integrated settings appropriate to their needs, consistent with the Americans with Disability Act or the Olmstead decision. For example, without adequate transportation options, these valued outcomes are merely words on pieces of paper. The 1021 Broadway Collaborative is a step in the right direction. OPWD's commitment to an office here in the city of Buffalo on a fixed bus route is another positive step. So too, as a stopgap measure, is shuttle service to the Western Regional Office in West Seneca. However, individuals with disabilities have a right to so much more. Donnie believes that the Inclusive Task Force can facilitate a community dialogue on the need for greater collaboration among all the stakeholders and engage in creative problem-solving exercises aimed at allowing individuals with disabilities to live fulfilling lives in the community. Thank you very much.
I'm used to speaking without one. I first of all want to thank my friends that are around the table, certainly Senator Kennedy, make sure you're giving our deep-felt thanks. Patrick Galvin, also a friend. I've been knowing Pat since 1997, working together with his office when he was sheriff. Thank you so much for being in support of this. And every other official that is here, we need the public official voice behind every work that we do. So what we're really talking about, I also want to thank the office of ODPB. I want to certainly thank that office. Because you were here, Frank, you came down to our public meeting, and we appreciate that. But what happened is that voice gets involved because nobody is hearing Mike. Nobody's hearing Andrew. Nobody was hearing Sam. Nobody's hearing Marie. So we have to bring in an organization and begin to organize around it. This is not how this country was built. We have a responsibility. Like first of all, I want to introduce you to a couple terms, right, that I have to do because I'm in a lot of social justice arenas where justice is not done for the least, the marginalized, the poor, those that are cast out, and those that are put away. So, but what I say to the people that's there, I say, I want you to learn a couple terms. One is Salvabano. Can you say that, Salvabano? Right, and what that means is I see you. He said, Mike, you come to my office, Salvabano, Mike, I see you. And you know what Mike's response is? Sakona, which means I am here. Right, so we recognize and acknowledge this, that Mike, I see you, and Mike's response that I am here, that means somebody that I need to give value to. Right, and sometimes, in our doings, we are not giving value to those individuals that are crying out and saying, all we want is our fair share. got two of the smartest individuals that I know. They could be in ED at any company or corporation around here. I need representation somewhere. I don't care if we had a training down in Denver or somewhere. We can send Marie. Marie will get up and tell the story and let everybody know. So when we are looking and making decisions about this group, what they're saying is nothing about us without us. They're saying we deserve to be the purveyors of our own destiny. We ought to have a say. People are constantly making decisions for those individuals that they don't quite understand, as opposed to saying, come, sit down at the table with us. Tell us what it is you need and what it is that we can do to facilitate that need. And we can't keep talking about money and resources. Our illustrious president just submitted a budget for a $639 billion defense budget, a $50 billion increase. But listen, and we're not at war. We haven't declared war. We have a responsibility to take care of what's happening in our domestic soil with the least of our community and those members of our community that didn't get a fair shot for whatever reason. We have to rectify that. And this is what this is all about. It's not just about this site. It's about any time something is impacting a group negatively, then they ought to have a voice that somebody will listen to. And then when they hear that, and they hear that cry, they're not just creating stuff. They're saying these are real things that are going on in our lives that's prohibiting us from living out a full life. It is the least that this country can do for our citizens. I mean, am I wrong here or what? And I think what's going on with Marie and Andrew and Sam, they fought the fight, and they're still fighting the fight. But sometimes they need additional voices because someone refused to do Salomon with them. Refused to see them. And I say they not only have merit and value, they also have credibility. Because they have done and fought this fight with honor, not defaming or bashing anyone. Even though Mike did want to hook off a few people. I encourage us to not only support, not just this initiative here. And thank you for those that have made this happen. We thank all of you that have contributed to this. I certainly thank my West Buffalo family. But we're looking for the entire community to embrace and wrap our arms around this group. God bless you.
We invite the senators to come up. We got a big postcard here saying that it's basically saying everything we said today, you agree to work with us, and you will pass this on to your other senators and stuff. So from Tim Kennedy's office and Senator Galvin, and it basically said the South Africans are losing their seats at the table in Region 1. The Office of People Development, South Africans are losing providers, satellite office right here, increase shelter services, OPWD, Region 1, inclusive workshops, and two other things. If you would like to sign that. Just to let you know,